Hello, I'm Dr. David Green with the Arizona Pain Network, where we connect those in pain with pain providers across the valley. Today, the topic is tailbone pain, which in medical terms is called coccydynia. Now, coccydynia can be very debilitating for patients and can be a real treatment problem. Now, why do people get tailbone pain? Well, the most common reason is if somebody has had a fall on their buttock area, it can fracture the coccyx. Now, this is a model of the spine. You have the lumbar spine here moving into the sacrum, and the bottom area here is called the coccyx. So it's shaped like a triangle, and you can't see it here, but there is a joint between the sacrum and the coccyx. It's a little bit of fibrocartilage in here. So if it's fractured and it heals in a weird position, it can end up causing chronic pain. Okay? Now, other reasons are you could have some irritation of the soft tissues around the coccyx from that trauma. You can also have a problem in the pelvis or rectal area that leads to tailbone pain. You can have a cancer in the area. You could have basically just some organ type issues that are causing pain that are not cancerous. Okay? But there's a multitude of reasons why people can have tailbone related pain. So part of the workup for tailbone pain would consist of obviously an x-ray, possibly an MRI to see if someone had a fracture in the past, is it still trying to heal. Okay? The x-rays can show if it healed in a weird position, it can show if there's sometimes a calcific growth. An MRI can help show maybe if there's a tumor or some abnormal growth in the region as well. Physical exam, you can look for, the doctor will look for where is it tender the most, does the pain go anywhere, all those types of things. What are the treatments for coccydynia? Well, first and foremost, medication management. Now, I'm not necessarily talking about narcotics. I mean nonsteroidals and anti-inflammatories and Tylenol, just over the counter. All right? Make sure you're taking it according to the manufacturer's recommended dosing, but those can be extremely helpful. All right? Physical therapy and chiropractic treatment can also help. That can provide some massage, electrical stimulation, ice, heat, some exercises for the pelvic floor and things like that. There's been some interest in a intrarectal chiropractic manipulation. Now, to me that sounds a little invasive, but there have actually been some studies looking at it. There was one back in '06 that showed that it does provide good temporary relief. It wasn't overwhelming, but there is that. A pain management procedure that actually provides really good benefit is called a ganglion impar block. And that is an injection that's done, there's a plexus of nerves, a collection of nerves that are right in front of the coccyx called the ganglion impar. And the pain doctor can do an injection in this area to block that ganglion, and it can give excellent relief for a lot of different problems in the area because that plexus of nerves controls a lot of sensation in the pelvic floor. Okay? So that can really help. Now, if that works and wears off, and the results are 50 to 70%, get 50 to 70% pain relief for months at a time, then another procedure called a radiofrequency ablation can be performed, which is basically applying thermal energy type heat to the area, pulsed fashion, and that can give really good results as well. I think the study that I looked at showed about 60% pain relief up to 6 months. Okay? So you have basically medications, chiropractic, physical therapy, the interventional pain management. As a very last resort, a procedure called a coccydyectomy can be performed. And that's a short surgery that just removes this bone from the bottom of the sacrum. The coccyx is taken out. Now, it's a roll of the dice. It's about a 50-50 chance of getting pain relief. And it's a low-risk procedure. I mean, there's obviously some issues in here potentially if you go too deep, but the procedure takes about half an hour. But that's an absolute last resort. It may be that electrical stimulation, over-the-counter medication, things like that do the trick. Okay? I'm Dr. David Green with the Arizona Pain Network. Your pain stops here.